Stefania. I'm gonna be your nurse for today. I'm just gonna close the door to provide you with some privacy. And then I'm gonna wash my hands and then we're gonna start, okay?
Okay. I agree to be recorded.
Okay, so I'm just gonna verify your information before we start. Okay, I'm gonna match it with the computer. Can you just tell me your first name, last name, and your date of birth, please?
Jessica Lopez, January 5, 95.
Okay, and do you have any allergies?
No.
And are you in any pain?
No.
Okay, so we're gonna go ahead and check your vitals. All my supplies are clean. Here, I'm gonna check your blood pressure. Okay, let me see your arm. Perfect. Okay, and your blood pressure is good. Is 90 over 70, 60. Okay? You have usually low blood pressure?
Yeah, just do later.
Okay. Okay, and then we're gonna check your pulse ox, and then we're gonna check your temperature in your forehead. Okay, your temperature is 98.2, which is good, and then your pulse is 99, which is amazing. And then I'm gonna check your pulse. Okay, I need to do it for a whole minute. Okay, so your pulse is 74, so that's good. And then I was able to count your respirations too. So that was 20, okay? So that's good. And then I'm just gonna finish when we left the other day. So I'm gonna check your neck. I'm checking for any that is symmetric, that your skin looks good, that you don't have any masses, or anything like that. And then can you just move your head side to side? Perfect. And then your chest is symmetric too. I'm just gonna check your spine.
Okay.
I'm checking for any deviation or any kyphosis, which is when you have this part of your spine with a curvature, or also over here, which is lordosis. But I see that it's good. You don't have any like S shape or anything like that. And then I'm just gonna check for your joints. I don't see that you have any edema, and then you have a good color. Have you noticed any like wounds, any masses, or any lesions, anything like that? Okay. And then I'm just gonna palpate your chest real quick, okay? Okay, and then I don't feel any masses or anything like that. Okay, and then so you're gonna squeeze my fingers. I'm just checking your strength, okay? And then your strength is good. It's 5 out of 5. And then put your arms like this and then push up. Okay, and then push down. Perfect. You're very strong. It's and then let me check your leg. Can you put it up? Okay, and then like push it up. Okay, and then the other one. Okay, perfect. And then I'm just gonna make you walk just to check your gait and your stability. Okay, perfect. And your gait's good. And then so next I'm gonna check I'm gonna hear for your heart. Okay. Okay, so first we're gonna go to the right. It's gonna be on the second intercostal space, and then that's called the aortic. Okay. Okay, and then we're gonna go to the this is the pulmonic, which is the second left intercostal space. Okay. And then we're gonna check over here in the middle, which is the left third intercostal space, which is the Erb's point. I'm sorry.
It's okay.
Okay, and then we're gonna go down over here. I'm just gonna lift your brow a little bit, and then that's gonna be the fourth intercostal space, and that's named the tricuspid. Okay. And then I'm gonna go right over here, and then this is the. I'm sorry. I'm gonna put it up a little bit. And then that's gonna be the mitral valve, which is on the midclavicular fifth intercostal space. Okay. And then I'm just checking for the S1 and S2 sounds, which the S2 is over here and the S1 is down here, and then that's just the lump knob that you hear from the heart. Okay, I don't hear any abnormalities. Your heart sounds are fine. And then okay, and then what we're gonna do next is I'm gonna check your pulses, okay? So I already checked this one, that's the radial one. Then I'm just gonna check over here your carotid pulse. And then we are gonna do it the left one first, then the right one, because we don't wanna do it at the same time, because then you're gonna pass out, okay? Okay, and then I'm gonna do this one. Perfect, the crescent, and then I'm gonna check for any bruit in your carotid artery as well. Okay. Okay, and I don't hear anything, and that's good because that's not supposed to be there, okay? And then I'm gonna check your brachial artery over here. Okay, and then we're gonna check the other one. Okay, and then let me see this one because I already checked that side. Okay, perfect. And then we're gonna do the one down over here, which is your popliteal. And then we're gonna do the other side. Okay, and then can you remove your shoes, please? Okay, thank you. And then I'm just gonna check over here. It's called the left lateral. And then we're gonna check the dorsal tibialis over here as well. Okay, and your pulses are strong and are 2 plus, okay, which is the normal one. And then, okay, now, so now I'm gonna have you like that, and then I'm gonna check for any murmurs, okay, which is with my little one again. And then will be, which is the bell. And then we're gonna do, so you're gonna be sitting first, then you're gonna be laying down, and then you're gonna be on your side, okay, on your left side. Okay, and then I'm sorry, I'm gonna put this. And then I'm gonna put it here. And then I will do it here again. Okay, and then, okay, now I'm gonna have you lay down. Okay, and then we're gonna do the same, okay? Put it here in the middle, I'm sorry. And then we'll do it here. And then we'll do it here. Okay, and then face that way on your left side. And then we'll do it again like that. And I'll put it here, I'm sorry. Now we'll do here. Okay, perfect. So I don't hear any murmurs. Okay. So that's a good sign. And then sit up again, and then I'm just gonna check your epical pulse, which is gonna be right here in your on your point over here on the mitral, which is the apex, and that's the maximum pulse of end pulse. Okay. And then we'll do it over here, and then we'll do it for a minute. Okay, and it's 74 as well, the same as your radial pulse. That's good. We don't want any difference between those two. Okay, and now I'm gonna have you lay down. Okay, I'm gonna check your belly. So I'm just checking for symmetry. I see that is flat. I see that's symmetric. Do you have any like different skin or any wounds, any lesions, anything like that? No. Okay. And I don't see you don't have an ostomy or anything like that. And then what I'm gonna do is I'm gonna listen first, okay? And then I'm gonna palpate and percuss. So we wanna listen first so I don't mess up with the vowel sounds, okay? Okay, so we'll start on the right side. We're gonna start on the right lower, okay? your bowel sounds are normal. I could hear them on all of your abdomen quadrants. And then I'm gonna palpate. Okay, I'm checking for any masses or any tenderness or anything like that. Let me know if it hurts. Does it hurt? No. Okay. And then I'm gonna percuss, so it's gonna make a sound. Okay. Usually, you could hear the tympanic sound, which is over here because you have your intestines in your stomach. And then the dullness is going to be more on your liver and your spleen. And then the liver is on the left side and the spleen's on the right side. And then that's going to be more of like a solid sound because the organs are there. Okay. Any pain or tenderness while I do it? Okay. Okay, perfect. And then, so I'm gonna have you stand up again, like sit down. Sorry. And then I'm going to check your cranial nerves. Okay. So we're gonna do cranial nerve number 1, which is the olfactory. Do you have any problem smelling?
No.
No. Okay. So I'm gonna make you smell this, and then you're gonna tell me what you're smelling. Okay.
Alcohol.
Perfect. And then we're gonna do the second one, which is your optic one. Do you have any issues with reading? Do you use glasses?
No.
No. Okay. And so that one we'll use the Snelling chart, but then we'll do that later. Okay.
Okay.
That's the second one. And then for my third, fourth, and sixth is gonna be the 6 cardinal fields. So we're gonna do it. So you're gonna follow my pen. Okay.
Okay.
Okay, and then I'm just checking for nystagmus, which is that movement of the eye, but you don't have it. Okay, and then we're gonna do cranial nerve number 5, which it's gonna be your sensation. So I'm just gonna do it with this little Q-tip, and then you're gonna tell me if you feel soft or sharp. Okay.
Soft. Soft. Soft.
And then
Sharp. Sharp. Sharp.
perfect. Okay, and then next it's gonna be cranial nerve number 7, which so I'm gonna check for your symmetry of your face. So I need you to smile for me. Perfect. And then can you puff your cheeks? And then can you lift your eyebrows? Perfect. And then then we're gonna do the 8th. Which is gonna be so we're gonna do for your ears, for your listening. So I'm gonna stand behind you, and then you're gonna tell me what I said. Okay. Orange.
Orange.
Apple.
Apple.
Perfect. Okay. And then we're gonna do number 9 and number 10. Which is gonna be the so do you have any issues with gagging? Okay, and then you're gonna do okay, perfect. And then we're gonna do number 11, which you're gonna shrug your shoulders. Perfect. And then move your head side to side. Perfect. And then we're gonna do the last one, which is our cranial nerve number 12, and then you're gonna move your tongue side to side for me. Perfect. Okay, and then do you have any questions for me?
No.
Okay, thank you so much, Jessica.
You're welcome. Thank you for everything.
You're welcome.